Could gallstones be the cause of my abdominal pain? Well, gallstones tends to cause abdominal pain in the upper abdomen, sometimes radiating to the right side of the upper abdomen, through to the back and round to the back, and sometimes to the right shoulder as well. The pain often comes on after eating, within about 5 minutes, 10 minutes, but sometimes longer, half an hour to an hour after eating, and can last for about 1 hour, 2 hours, or sometimes longer. Occasionally pain lasts overnight and can be very, very severe indeed. If the pain doesn't go away, or if the patient feels unwell, then the patient may have an infection in the gallbladder caused by the gallstone. What are the causes of gallstones? Well, most of the time we don't know why patients have gallstones. Gallstones are extremely common. For example, about 1 to 2% of the population will have gallstones, and most of them are not symptomatic. A small proportion will become symptomatic. Some patients have illnesses that can lead to gallstones, for example, if they've got inflammatory bowel disease, if they've got hematological problems like sickle cell disease, or if they've had surgery, but usually we don't know why patients get gallstones. What are the treatment options available for gallstones? Well, there are a variety of options we can offer for managing gallstones. These range from a non-operative approach to an operation to remove the gallbladder. Where stones are causing a problem and the patient doesn't want an operation, having discussed it with their surgeon, the patient can manage them by having a low-fat diet, sticking to healthy foods, avoiding predominantly dairy foods and sweet foods, foods that don't stimulate the gallbladder. The problem with that is that patients will not get rid of their stones, they'll still remain in the gallbladder, and we find that with this approach, about half the patients will come back with ongoing symptoms at some point in the future. Usually the other option is to remove the gallbladder, which is a keyhole operation that I do, with 4 small incisions on the abdominal wall, and the operation is usually done as a day case, where patients are admitted in the morning and they go home the same day. What is the recovery time for treatment after gallstones? Where patients have had an operation to remove the gallbladder, the operation is usually done as a day case, which means they come into hospital in the morning, have their operation late to mid-morning and go home in the afternoon. Sometimes patients are in hospital for longer, usually 1 night only, for a variety of reasons. If the operation has been complicated, then they may have to stay in hospital for longer, up to 3 or 4 days, and occasionally longer than that. My expectation after a routine gallbladder removal operation is that patients are back to normal almost within 2 weeks or so. Will my digestion be affected after my gallbladder operation? A small proportion of patients do have digestion problems after their gallbladder has been removed. This is because the job of the gallbladder is to aid the digestion of fat in the gut. This is quite a rare problem but can be treated.